every doctor is different.
And they will be definitely facing in the field as well, like the different surgeons come with
Yes.
different kind of,
Different preferences,
patterns.
different attitudes.
Well, I just want them to feel as comfortable as possible.
As a
because
beginner.
because are they doing it right or not? I mean, if I'm scrubbing like 9 times rather than 10 times.
I want to see them spin properly, passing the tag off properly.
So they can spin by themselves too, right?
No. Sometimes you are the only one in the room, too. You gotta call for help.
Okay.
I need help.
Okay. Save them time.
Save them tons of time.
And
yes.
they can save their points and do not fail, right?
Exactly.
So that's the whole.
Calling yourself out on a mistake, because we all make mistakes. It's inevitable.
I don't think I do anymore.
I'm sure you do.
What is the grading policy, by the way, for the Hello everyone, welcome back to another episode of Surgical Tech Show, and today I have brought a very important and very amazing and some full of information episode for you guys. This is mostly going to help to those people who are already in the school and what we are expecting from them. That is the whole topic and that is the whole plan, what the staff actually is expecting from the students. And I have very special guest. And the guest I have, she is actually an instructor and she has done a variety of cases in different places with very great experience. And I'm gonna just start talking to her right now. And I have Miss Kiara Lesser with me today.
Hi.
How are you?
I'm good. How are you?
Great, great. Okay, so this episode is all about like for the students who are in the school, and the reason I just brought you up because you have very extensive and have done like a variety of cases is going to be good. And besides that, I mean, as an instructor, what you are expecting from the students, because students are the one who just keep asking like all the time, like what exactly the staff is actually expecting.
Yes.
And the other thing is sometimes they are just confused and nervous, like what they should be doing, how they should be doing, and what is the best option for them in order to be, successful.
Yeah.
A
lot
student.
of things.
Exactly. So my very first question to you is, what basically you are expecting from them?
Mm-hmm. Well, I would really like for them to have confidence in themselves, because if you have confidence in yourself, it makes it so much easier, especially if you know the purpose behind the procedure and what we're doing and the sterility, then you can pretty much wing anything.
But do you have like very high expectations from them or something like that makes them like nervous? They don't know anything.
Yeah.
That is the point when they get nervous, like all of a sudden.
Yeah. When they're in the beginning of school, I wouldn't say we have too many high expectations because it is a brand new world to them, and some come with no experience in the medical field at all. However, some do, but we have to teach them by the book, which makes it a little harder for them to tweak things they've already learned out in the field. Correct. And actually make them pass the board exam. But when it comes to the expectations, I would say they're low in certain areas, but they're higher in things that are very important.
Because they don't know anything, how they should ask the question. That is probably something that is making them confused, don't you think?
It makes them so nervous because they don't want to be judged by each other. They don't want to feel dumb. So it gets them nervous of, what kind of questions should I be asking? What is my next step? Sometimes it's hard to find the wording for them on how to ask the questions. Sometimes if they just come with a topic, hey, when I'm opening up this pack, okay, let me show you. So I feel like when it comes to their questions, we love them.
Yeah.
But
so
it's hard for them.
That's basically you're expecting from them, right?
I'm expecting a lot of questions.
There's multiple instructors in the school.
Yes.
Where you teach. So everyone has different kind of
teaching
ways of, and the teaching pattern as well and stuff like that.
Yes.
So sometimes they're like thinking like who is right, who is wrong. What would you say about it?
We all have different knowledge and we've all done different specialties and things. There is no wrong way necessarily, as long as the sterility is there and you have that integrity to know when you've made a mistake and how to fix it. There are multiple ways of doing things. So I would take it and learn from each instructor which way they do it and then find what works for you best. No way is wrong. There's multiple ways of doing everything.
So as long as there is no breach in the sterility or stuff like that?
Exactly. As long as your sterility is there, then anyway, as long as you get to that outcome, then you're golden.
What do you tell them? Like, I mean, if they come and say like, okay, other instructor told me like that, and what do you tell?
I would say, what was wrong with that? What did you find that was wrong? And then if they say, well, I don't think there's anything wrong. Exactly. There's nothing wrong. Try that way, but here's another way of how to do it as well.
Correct.
So here's 3 or 4 different ways on how to do it. You find what works best for you, because no tech is the same.
Okay.
Every setup is different. Every doctor is different.
That's true.
So you have to accommodate and be flexible.
And they will be definitely facing in the field as well, like the different surgeons come with
Yes.
different kind of, I mean,
Different preferences,
patterns.
different attitudes.
We will go over with that definitely. And so I think we better come to the point, like when they are about to going through those terms, term number 1, term 2, and then 3 terms probably they have, or 4 terms?
4 terms total, but the 4th term is all clinical externship out in the actual field.
Okay, so let's talk about term 1 first, and then we will go over the other terms as well. I just want them to feel as comfortable as possible.
As a beginner.
Because they are the one who get like more confused, like what they should be doing, how they should be doing, and what makes, because it's like overloaded for them.
Yes, it
everything
really
is brand
is.
new, and they are still confused, like what they should be doing, how they should be doing. It's kind of hard to for them.
Yeah.
And it's hard for us probably as well, how to make the things for them.
Yes.
So let's come back to that. Like when they are doing their practices, what are the patterns? I mean, I will go probably one by one, but would you like to tell me, like, what is the first thing that they should be doing, you think?
So the first thing is, depending on which procedure we pick for them to do, I would like them to have like a concept of what's the purpose of the procedure, what's the anatomy affiliated with it, and then we start from there and we teach them how to come into the room from the hospital. You'll put your scrubs on, you'll put your PPE on, and then you're going to perform a damp dusting in the room, because although they terminally clean, you still have to wipe down that room prior to opening anything, just to make sure that it's nice and clean.
Okay.
So we go from there, and then after the dusting, we teach them how to read a preference card, because doctors have their preferences.
Correct.
Every card looks different. So we give them some samples, and then we teach them how to go into the supply room and pick all of those sterile
So how
supplies.
those preference cards are made?
Each different instructor has created their own card. Little tweaks here and there, because we have such set things. So
Makes sense, yeah.
so we will tweak the dressings or the sutures pulled. Instruments, not so much. Those are pretty across the board with what we have here at school.
Okay.
But we'll do little changes.
So the very first thing they need to know, like what case they are doing, I'm assuming, right?
Yes,
So
yes.
this is a very important
So
thing.
we usually start with maybe like an inguinal hernia, something very basic.
Okay.
That they'll probably do every day out there.
Of
At least a
course.
basic setup.
Yeah, yeah.
Yeah.
So what would be the next step they would be doing then?
After they have shopped for all their supplies, they'll check the patient allergies to make sure that they can open all of their supplies. And once they've checked the allergies and the allergies are good, they'll check the integrity of all of their supplies, make sure all the expiration dates are fine, there's no holes, rips, tears, water, anything like that in those supplies. And then we'll teach them how to open them sterilely.
So you think they need to know the allergy before they pick the case, shop for it, or after?
It would be ideal to know it before. However, out in the real world, sometimes the cases are already pulled for you with no prior knowledge of your patient and their allergies.
So as long as it's not open.
As long as you haven't opened it yet before checking the allergies, because once you've opened it and then you find they have an allergy, everything must go in the trash. So
That's
saving
I
costs.
So coming back to that, like, okay, if you can probably tell me the sequence of opening, that would probably help them too.
Yeah, absolutely. So after you've checked your integrity of everything, you will start with your back table pack, your lap pack. You'll open that up. That's going to establish your sterile field on your back table.
So back table first.
Back table first. Then from there, we usually do our basin and our single ring stand or double ring stand. You'll open that and you'll marry that to your table. That way you have a nice big sterile field. And then from there, I always tell them to open up their peel pack supplies. So everything that is pulled specific for that case. And that we focus on the technique of how they're opening. That way they're covering their entire arm. They're not, contaminating anything, keeping their distance from their field. And then after they've opened all of those supplies, then they'll open their instruments.
Okay.
Now, depending on your instruments, it may be in an actual metal tray or it may be wrapped. So we teach them both techniques so they know how to handle that out there.
Okay.
And then from there, they open up their gown and glove on their Mayo stand. Once they've opened that and everything is opened, everything looks good, then they go to their surgical scrub. From there, we teach them 2 different surgical scrubs. There's a timed method, which we do about 5 minutes here.
Okay.
And then they have the stroke method, which is also where you're hitting every plane as well. You're just focusing on hitting your 20 scrubs, your 10 strokes. We teach them both, but when it comes time to check off, they pick which one feels right for them.
I see. Okay. So, as far as I can tell, like the back table first, and then they should take care of the ring.
Yes.
And then they should be opening their splies.
Yes.
Whatever the splies. Okay. So if they just do the third step first, is that okay or no?
No. The sequence and the steps, at least the first 2 or 3 steps, are crucial. And then after that, you can open up your Mayo stand with your gown and glove if you want to do that first, versus your instruments. That again is your choice, but you have to keep in mind how you're working and walking around in your field. You don't want to go between 2 sterile fields and contaminate anything, which we emphasize a lot in our lab in teaching them how to walk around, keeping their distance, and being aware of what is sterile, what is blue, and what you can keep your distance from.
Makes sense.
And
Makes
stuff
sense.
like
Okay.
that.
So splies are open. So what would be the next?
After your supplies, either your instruments or your gown and glove on your Mayo stand. I
Okay.
would personally do my instruments.
Okay.
However, another instructor may do their gown and glove.
Okay.
It's not wrong.
Okay. No, that makes sense. So they should be doing the surgical scrubs after that, right?
Yes, after everything is open, then their surgical
So
scrub.
when they are doing that, what exactly you are looking when they are doing the scrubs? What exactly you want to see? Like,
That's
is it correct or
very
not?
good question.
They're confused, like, are they doing it right or not? If
Yes.
they're contaminating something or not. I mean, if I'm scrubbing like 9 times rather than 10 times, are they really counting
It's
on me?
hard. Yeah, for a while I did count every stroke a student did, and it was a lot.
I did too, yeah.
Your head is just counting.
I mean, obviously at the beginning everyone is nervous, so yeah.
Yes. And, you may see us demonstrate it and you may think, oh, that's easy. But until you physically do it, your arms are burning. You realize it's a lot of factors into just one thing. And that's what being a tech is. It's multiple things, making it look smooth and easy, but it's really not.
So are you really not counting?
I count as much as I can. My main focus is that they're scrubbing their nails, that they're hitting every plane, that they're not going back over an area they already scrubbed, that they're using the circular motions, that they're hitting their 3 parts of their arm and going all the way up to 2 inches above the elbow, that they're doing 1 full arm and then doing the second arm, and how they rinse off. Make sure that they're starting at the tips and they're letting everything drip off the elbow. They're not accidentally touching the faucet or anything, and we're looking for that surgical conscience because, sometimes you may put your hand through the water and you touch the faucet. Are you going to tell on yourself or are you going to keep it inside?
There's a chance,
Yeah, that's where we're focusing too, because your soap suds are going to tell on you.
Yeah.
We're going to see them.
No, that's very true. Okay, scrubs are done. So this is the very important thing, and I think they will definitely get an idea. Like, probably we are not counting, but with the experience, we can tell, like, are they doing the right or not?
Yeah, I keep an eye on the clock.
What about the time? Do you
usual-
think like the time is better too?
Yeah, usually a typical surgical scrub is around 3 to 5 minutes. So if you're finished in 1 minute, obviously you haven't
That's a-
become surgically clean.
That's a question. Yeah.
If you're 5 minutes, okay, and I see I don't see any parts of your arm that haven't been touched, that you've hit every area. It's not necessarily the counting of every stroke. It's just making sure that you've touched every part of your arm that needs to be touched.
Correct.
And in the correct, pattern and motion and everything.
Okay, so I mean, if they are doing everything perfectly, so the next step, I'm assuming, would be like just to dry it out. So how they can dry now?
So when they opened up their gown and glove on their mayo stand, a towel comes with it. So we teach them how to walk from the scrub sink, get to the OR door, which you obviously can't grab the handle with your hands because they're up here. So we teach them how to back in, and then they'll walk over, how to pick up their towel properly, open it up, and then swoop their hand under and to dab dry. We don't want them to just, how you get out of the shower drying off. You don't want to cross-contaminate. So our big focus is having them back away from that mayo stand as well after they pick up their towel to make sure that they don't touch it on anything.
So they just approach the towel, pick it up quickly, and then step back.
Yes, and then open it up. And then that way it's opened up. They can pick what arm they want to use first to dry off. And then
So they can grab the towel with two hands, or no?
pick it up with one and then grab one of the other ends and open it up nicely.
Just find another corner, like from
Yeah, find the
like
opposite corner.
So it has to be like horizontally or vertically.
I personally do it horizontally. That way I can
helps.
swoop my hand under because you want it to kind of lay down here.
It helps, yeah.
That way you can dry with just that top part of that towel, and then at the half point, you're going to swoop the other hand and dry the other hand with the other half. That way it's perfectly been cut in half, basically.
Okay.
And then another thing that I focus on too with that towel drying is that whatever hand they finish drying off with, that they throw it away with that same hand, as well as their scrub brush too. You never want to finish scrubbing this hand and then grab it back with that same hand you just did, because you want to throw it away with what you finished with. Don't go back and forth with it,
I see,
just like your
yeah.
towel.
So the other thing is, like, since this is term one, so what is their end of the setup you want to see? I think
Where we want them to finish off,
yeah,
kind of thing.
yeah.
So after they scrub in, I want them to then gown and glove. I want to see them spin properly, passing the tag off properly, knowing that if the string drops, how to handle that situation out there.
So they can spin by themselves too, right?
No. And that's a good thing that we teach them too.
Because sometimes
who
I
you
feel,
can spin with.
No, but sometimes I feel like, okay, I'm a smart guy.
Yeah.
I can do everything by myself, right?
Exactly. Sometimes you are the only one in the room too. You gotta call for help.
That's all they can do probably.
Yeah.
Yeah. Okay.
I need help.
Okay. So this is very important.
Yes.
Find someone else.
Finding somebody else, passing off the correct part of the card to them and not touching the card again. Making sure you don't drop the string, and if you do drop the string, who can tie it for you?
Okay.
And then from there, I want them to organize the things that have come in their back table pack and what comes in their basin, and create a barrier on their table, because the table pack is so thin, you can always scratch through. So I like them to lay out towels just to have that extra protection.
Yeah.
So that's usually the first step I'm looking for. And then to drape their mayo stand as well. That takes some practice.
It does.
Because you
It
can't
does.
let it drop. You've got to really put your foot down and feed it slowly.
Yeah.
So that, laying it out with the barrier of towels, and then organizing. I love a back table that has a section for all of your things you're going to count. And then in the middle, where you're going to retrieve your instruments and put those to be counted. And then an empty area where you maybe need to work get
area.
a specimen, something like that. And then your basin is usually with the drapes and the surgeon's gown and glove. Then I would like for them to retrieve their instruments. So that in itself...
What does that mean when you say retrieve the instrument? What exactly does that mean?
So if it comes in a metal casket, then they will have filters on the bottom. So they usually need their nurse to check those filters. So we teach them how to come over, grab the tray out, sterile, and then they'll say, "Nurse, can you check my filters for me?" Nurse will take the filters out. So it's all about holding the tray away from your body just in case it is not sterile. So teaching them to get a good grip with it, hold it away from your body, give your nurse, some time to check those filters.
What is wrong if they're grabbing close towards themselves?
If that tray has not gone through the correct sterile process and you've touched it on yourself, now you have to re-gown, re-glove, re-scrub before you do those things.
Okay, makes sense.
Very time consuming.
I see. So just in other words, you are saying like, I mean, if there's any contamination, they can just change their gloves and good to go?
Exactly. As long as it hasn't touched their gown, they can change their gloves, pass off that tray back to the nurse, get a new tray, get some new gloves, and continue on.
Save them time.
Save them tons of time.
And
yes.
they can save their points and do not fail, right?
Exactly.
So that's the whole point. How you are trying to see their setup? Term 1 I'm talking about.
Yeah.
How you want to see their, the setup?
So I would like to have them have their Mayo stand draped out with a towel on top, close to their back table, that's organized with all of their things that need to be counted.
So that is that the point where their setup is done
For term 1.
For term 1. Okay.
Yeah.
And then this is the end. Okay. So what they are expecting, what would be their second term now? I mean, what would be
So now in term 2.
because that I think that is definitely a point where they will start thinking, okay, our first term is over right here, and what would be doing
I can breathe.
next term now? That is their
Yeah. So the next term we like to just keep building on. So now they've established that simple, beginner setup. Now I want them to learn how to count all of their supplies.
I see.
So they'll start learning counting their softs, their sharps, their miscellaneous, their instrumentation, and then receiving medications, loading their blades, those type of things. And then they'll learn what instruments will go on their Mayo stand, what instruments are needed for that specific case. Then they'll learn then they'll have their surgeon scrub in, so they'll gown and glove that person. They do learn that in term 1, but that's not part of the checkoff. We'll do that in term 2, because then they're going to learn how to drape the patient out with that doctor. And then in term 2 as well, after they've draped out the patient, we'll actually pull up and teach them how to do the actual procedure.
Wow, that's awesome. So I think they will be definitely excited to when they move on to this. But anyways, so if they can perform up to this, like taking their instruments and done, they don't need to even set up the instruments, right?
They don't even need to set it up.
Okay, perfectly. So after that, you think they will pass?
Absolutely. If they really focus on the sterility, or if they do make a mistake, they correct it. That's a big thing we look for, because you have to have that surgical conscience and that integrity of calling yourself out on a mistake, because we all make mistakes. It's inevitable.
I don't think I do anymore.
I'm sure you do.
It's funny. Everyone thinks like, how
they have to be perfect.
I mean, I did that. How can I be wrong? I mean, that's how it is. It's a human psychology, basically.
Yeah.
But this is a kind of a thinking like, I do it like all the time. How can I be wrong?
Yeah.
So,
years into it, and you'll still make a mistake.
What is the grading policy, by the way, for the term 1? So they can be like a little bit conscious about it and not be nervous.
Yes. So they receive a rubric that's laid out with each step. So it'll start out with their, as long as they have their PPE on, they get 5 points. If they're missing something but they correct it, they get 3 points. If they completely haven't noticed, they're oblivious to the PPE, it's a 0. So each category for that procedure. So PPE, doing a damp dusting of the room.
Oh, wow.
Each step for that sequence of getting to that final setup.
Yeah.
And so that they must receive a 70%. It's out of 100 points.
By saying 0 actually makes me like sad now.
Well, as long as you correct it. That's what I always try to tell them. Talk it through. It sometimes helps to be vocal, because if you're talking yourself through it and remaining calm, because a lot of them, they let their nerves get to them. And it's like, take a deep breath.
Yeah,
it's going to be okay,
Yeah.
And as long as they're utilizing class time and practicing, they should pass with flying colors.
So how they can speed up this whole process up to here? Because the thing is like everything takes time. Every single thing is taking time. So the problem is like they just want to go fast and fast because they have a very limited time.
Yes.
By the way, I forgot, like, how much time do they have?
Yeah, they'll have 45 minutes to complete it. So
45 minutes from when to when?
from when
Starting
they,
when?
yeah, when they introduce themselves to us and perform their damp testing, the time will have started. They've got 45 minutes. That includes their surgical scrub, their shopping for their supplies, checking patient allergies, integrity, during their surgical scrub, gowning and gloving themselves, and then setting that base with the towels and everything in 45 minutes. So a way for them to cut down time is knowing your supply room. Because if you know what supplies you need to pick, it should
It's
take...
gonna be quick.
Yeah.
So I think I would just cheat myself and memorize all the supplies what I need to pick
Yeah,
and then
yeah.
just do it.
Go keep practicing, taking the preference card, shopping around, timing yourself, make a little game out of it. And then see if you can keep your shopping in about 3 minutes, you'll have more time later on for the things that actually need more time. If you time yourself and get your surgical scrub to about 5 minutes or less, that's even good too. You don't want a 35-minute scrub and then you're rushing for everything
No, I think
else.
this is amazing information. Honestly, I think this will definitely help them.
Yeah.
Like how to progress and how to be not nervous. Because some questions they are confused how to ask.
Yes.
And is it a right question or not, or it might be a stupid question.
No stupid questions.
That's why they call question basically. Like we
Exactly.
don't know. If we know everything, then we don't need to ask anything, obviously.
Yes, yes.
So when you're coming to some new thing in the world, obviously you would have everything to know.
Yes.
So you would have millions of questions. Any suggestions for them that might help them in order to, succeed and
I would say
any cheating points, I mean.
utilize that class time wisely, because at least for here you have in term 1 you have about 4 hours a week in lab. Right now we don't have open lab hours for them to come and practice, so I like to send supplies home with them to practice at home. Using a friend, a family member, a significant other, anybody who you can...
So when you say
help.
supplies, I'm confused. What kind of supplies they can take home?
So I like to send them home with a couple scrub brushes so they can practice their surgical scrub at home, practice in the shower, at the bathroom sink, anywhere you can, because your arms are going to burn. You're going to feel that burn.
But they can practice on streets too, I think, right?
If there's a scrub sink out there, sure.
But the whole point is how to practice, basically. That's the
Yes,
whole point.
yes.
If they can.
Bringing scrub brushes, bringing peel packs home. You can peel pack a couple spoons from your drawer, peel pack some Q-tips.
Yeah.
Anything that, and we have all different sizes of peel packs out there, so I really love for them to get a variety of different sizes and shapes and things to open. And then I send them home with some gowning gloves so they can practice gowning themselves, drying off, refolding it. We teach them how to refold everything, so we can cut costs, and then they can do it at home.
Okay, well, I think this is enough information. I think it's more than enough as far as I can tell.
Use every minute you can.
Yeah.
If you see there's 15 people in your class and there's, so many tables, but there's an empty table over there and you see nobody else is using it, run over there and get
there's
it.
a chance like they might not even get more time in the later on days.
Exactly. You have your designated 16 weeks, and that includes checkoffs already as well as time for the final. So you really have probably about 13 weeks, which you only have class once a week, so 4 hours. You really got to use that time wisely. And find a partner that you work well with.
That's another
and that
idea, yeah.
you can, you're not going to get your feelings hurt if they call you out, because that's what you want. Somebody to, if you don't notice it yourself, hey, Yusuf, you just touched that. You know what? Thank you, because I didn't notice. Now I'm going to be more aware of it.
Just take it.
And
but if you have any issue, you can talk to instructor to make sure, like, was there anything
Absolutely.
wrong?
Call one of
Just
us
to make it
over.
correct,
I
yeah.
think I touched this. Is there a way to fix this, or is it, do I have to restart over? 95% of the time, you can fix something out there.
I think the term one would definitely get some.
And the more you practice, the more confidence you get. And the more confidence you get, the nerves go away.
So
And
speed-
it'll make a big difference in your final checkoff, because
Speed
if you're-
basically comes with like
with the
practice.
with the confidence and the nerves.
Everyone, I hope you guys like this show. The other questions you might have, you can definitely ask anytime, and we will try to make it solved for you guys.
Perfect. Thank you so
Thank you.
much.
Thank you very much. I appreciate that.
Mhm.